Thank you for joining us for another episode of PT Talks. I'm Austin Tripp with Advancing Health Physical Therapy, and today we will be discussing TMJ problems, or temporomandibular joint dysfunction. According to the National Institute of Health, over 10 million Americans suffer from TMJ problems, and some sources even put this number as high as 35 million. TMJ problems can make it difficult to eat and chew, difficulty with motion, and also difficulty with daily activities such as working and driving. Statistically, there are more women that are affected with TMJ problems than men, which has led some researchers to start to look for a hormonal link for TMJ problems. But there's really no known cause for TMJ issues. So today we're going to be talking about the symptoms of TMJ problems, the anatomy of the TMJ joint, some things that you can do as far as treatments, and how physical therapy can help. So if you have TMJ problems, some of the things that you may experience, you may have pain when you open your mouth, such as talking or eating. There may be decrease in neck motion. There may be locking of your jaw, a painful popping or grating in your jaw, and you also may experience a separation of the way your upper and lower teeth connect. So let's look at the anatomy of the TMJ joint. So the TMJ joint is comprised of two bones, the temporal bone in the head and the mandible or the jaw. And where these two bones articulate creates the TMJ. At the end of the mandible, there is a rounded part of the bone called the condyle. And the condyle is the actual part that connects into the temporal bone. In between the condyle and the temporal bone is an articular disc, which can cause problems if this disc is moved. Some of the muscles that affect the TMJ are both direct and indirect muscles, because there's a lot of muscles that directly affect the TMJ joint, but there's also some that indirectly affect the TMJ joint. So we're going to be looking at some of the muscles that are more common that have the direct effect on TMJ issues. So the first one is the temporalis, which is up in the side of the head and it runs down towards the TMJ. The next one is the masseter, which is on the side of the jaw and then runs up towards the TMJ. And then we have two muscles called the medial pterygoid and the lateral pterygoid. And these muscles are in your cheek and mostly kind of behind this arch, this bone here called the zygomatic arch. Those muscles are deep to that. And so those are four of the main muscles that have a direct impact on the TMJ. But again, there are other muscles that indirectly affect that as well. So some of the treatments that you can try, obviously anti-inflammatories. So whatever you would typically take for pain might be good to help with inflammation and pain in the TMJ area. You can also try a night splint. So an orthodontist or a dentist would be who you would need to see in order to obtain a night splint. Physical therapy. And we're going to talk about some ways that physical therapy can help in just a little while. And there's also some things that you can do at home to help with TMJ pain, such as avoiding opening the jaw excessively, such as with loud singing or chewing gum or yawning very, very largely, avoiding soft foods or very hard foods, are just a few of the things that can be done at home. Now, as far as physical therapy, how can physical therapy help with TMJ issues? So, with all of my patients that come in for TMJ problems, we always address both the TMJ and the cervical spine, because there's a very high connection between TMJ pain and cervical pain, neck pain. So we would address both of these areas. So we would include stretching and strengthening exercises, which would help both the neck and the jaw. We would look at posture exercises because posture plays a very large role in TMJ flare-ups. We could also do dry needling, which dry needling is inserting a very small needle, very similar to acupuncture, into certain muscles and areas, both around the TMJ joint, but also in the cervical spine, which have been shown to help reduce pain, inflammation, muscle tightness, and improve healing in the TMJ joint. Physical therapy, we can also improve the motion of the jaw, and we can do stretching of the specific jaw muscles. And if you're having difficulty opening your mouth, we can do some things to help improve your ability to open your mouth. So if this is something that you're interested in or you have questions, I would love to be able to help you figure out what you need to do. So you can email me at physicaltherapy@advancinghealthpt.com. If you have a question, I would love to be able to answer that. And even if you don't come for therapy, I would be willing to help you figure out what you need to do. If you would like to get a night splint, I have several dentists that I can try to connect you with who can help get you a night splint to help improve your grinding at night or your clenching your teeth at night, which both would affect and exacerbate TMJ symptoms. So if you haven't, you can also give me a call at 251-301-0574. Thank you for joining us for this episode of PT Talks. Have a great day.